Hello everyone, I'm Dr. Munir Basi once again from Daniyal Ultrasound Clinic, sonologist. In today's video, we will discuss a very common yet often misdiagnosed condition called adenomyosis of the uterus. The ultrasound shows here an enlarged uterus with features suggestive of adenomyosis, and the patient's history includes pelvic pain and heavy bleeding per vaginum. Now let's understand how to identify adenomyosis on ultrasound, how to differentiate it from fibroids, and what is its clinical significance. So what is adenomyosis? It means that endometrial tissue, the glands and stroma invade into the myometrium, the muscular wall of the uterus. So instead of being limited to the inner lining, these endometrial cells start growing deep inside the muscle layer. As a result, the uterus becomes bulky, tender, and heterogeneous in texture as it looks over here. This condition is often seen in women of reproductive age, usually between 30 to 50 years, as we have got this patient. She's about 45 years old, and is associated with pelvic pain, heavy or prolonged menstrual bleeding, and dysmenorrhea, as she complains. Dysmenorrhea means painful periods. So here ultrasound findings, they show few key points. There is enlarged uterus. It is a globular in shape rather than having a normal pear-like contour. The endometrial lining, it appears, or endometrium appears heterogeneous with ill-defined areas of increased echogenicity mixed with small cystic spaces like you see here. Here are cystic spaces spread all over the myometrial parenchyma, myometrium or the parenchyma of the uterus. Uterus is globular, enlarged, and these tiny myometrial cysts usually they measure 0.2 centimeters in diameter, or this is a classical picture of adenomyosis. Sometimes you can see a Venetian pattern or Venetian blind or stripped shadowing pattern on the posterior wall. This is another suggestive sign, but it is not shown here. So in many cases there is asymmetrical thickening, more common involving when there is posterior myometrial wall is involved. But here it is a diffuse enlargement, diffuse involvement, so it is a symmetrical shape. The endo-myometrial myometrial junction or the zone becomes poorly defined. Here is the poorly defined, and it becomes just you cannot differentiate between adenomyosis from fibroids sometimes. But color Doppler, it shows increased vascularity, and you can easily differentiate it from the color Doppler. On the color Doppler, the difference between tiny or the seedling myomas and the infarcts or the, as I told you, the small cysts. So in past videos, I have told you that the fibroids are usually well circumscribed around hypoechogenic masses or hypoechoic masses with age shadowing, and sometimes they show calcifications. But in adenomyosis, on the other hand, has no definite borders, a diffuse heterogeneous pattern, and small cystic spaces spread all over the myometrial tissue. Also in adenomyosis, the uterus looks globular and soft, while in fibroids it may look lobulated or nodular. So clinically, adenomyosis causes diffuse pain and heavy bleeding, whereas fibroids may cause pressure symptoms or focal mass effect. So now, friends, when you see an enlarged heterogeneous uterus with poorly defined junction or junctional zone and tiny cystic spaces in the myometrium, always keep adenomyosis on the top of your differential diagnosis. So thank you very much for watching my video. If you found this video informative, please like, share, comment, and subscribe to my channel for more detailed ultrasound cases and discussions. I'm Dr. Munir Abbasi. See you in the next video with another interesting case in sonology. Thank you.